Good morning. My name is Dr. Mabeba. I'm a child psychiatrist based in Vista Clinic. As we are all aware, this month is Autism Awareness Month. I would like to share a few pointers and I hope it will help. What is autism? Or we can say autism spectrum disorder. So in DSM-5, the definition of autism is autism spectrum disorder is a neurodevelopmental disorder and is characterized by a few pointers. 1, people who are having autism spectrum disorder struggle with social relations and social interaction. 2, they've got problems with verbal or non-verbal communication. And the third factor is they've got what we call repetitive or restricted interest. So maybe just to clarify what we mean by that. So people that are having autism, they struggle in having relations with people. In other words, they have difficulty in making friends, communicating, or engaging socially with people. They've got difficulty in even understanding the social cues. They got difficulty in reading social emotions, or they can't relate very well with people. 2, when we say they've got non-verbal or verbal communication issues, they've got difficulty in seeing what people are showing on their faces. If somebody is sad, they can't read that easily. And sometimes they even struggle with what we call empathy. When referring to repetitive or restricted interest, we mean that you find that they would like to do something over and over again the same, or if they're interested in an activity. Say for instance, if it's a child that is interested in dinosaurs, they would go deep, zoom into that, only want to talk about that, and they would know the details of that, and they wouldn't want to talk about anything. So they've got that restricted interest and they become very rigid. Let's talk about the red flags. So you don't have to be a doctor, psychologist, social worker. This is for ordinary person. What are the red flags that you should look for? If you've got a child that doesn't show any awareness of others, a child that doesn't have imaginative play, or maybe having poor imaginative play, in other words, a child that is unable to take a wooden block and play with it as a car. And the development of speech and language may be delayed or atypical. And this is one of the key things that people present with: no speech, or speech that has developed and disappears. Or some children have got atypical speech. They've got what we call echolalia. So when you say something, they repeat it. When you say to them, come and eat breakfast, the child will say, come and eat breakfast. So that's what we would call echolalia. They will repeat everything that you say. Still on the speech, and children on the spectrum, they have minimal reaction to verbal or non-verbal communication. In other words, you can call this child and this child might not respond, or they might even seem like they're deaf. And again, the other features that you should look at: changes in routine or environment cause a lot of distress. So if you change things the way you used to do them, they can get very distressed. Or you move and go to another place without a warning. They like predictability. Another feature is that they like to do the same activity over and over again. They don't like changing. They can repeat an activity. Even with food, they are fussy eaters. They wouldn't like certain kind of foods, or they would like a kind of food and want it to be repeated day in, day out, day out, without stopping. And the other feature is they can display extreme distress on tantrum for no apparent reason. This is a very important feature. We call them meltdowns. And there would not be any reason for them to be throwing the tantrum. And another red flag that we should also look at: they've got no real fear for danger. In other words, they might even be like, they can be hurt and they don't show any feeling. They don't even cry, even if there's blood coming out. And they prefer to play alone. Sometimes they've got what we call self-injurious behavior. So they can do head banging, rocking, scratching, or even biting themselves. Sometimes they've got unusual habits, hand flapping. So this hand flapping could be caused by many things: distress or excitement. And by that we mean like they can do like this and they make sounds. They can talk to themselves and laugh alone. And they are very indifferent to certain things. They dislike being touched or held or cuddled. And this causes a problem because people like to hug and kiss their children. Children on the spectrum might not like that. And the other important factor is about the senses. They've got what we call heightened senses, right? So their senses can be heightened or lowered. In other ways, it can be touch, taste, sight, hearing, or smell. What do I mean by that? There can be a heightened sense of touch. They can like to be touched in a hard way or not to be touched at all. Taste. They might be so able to taste things, or they might not be able to taste things. Some kids would like bitter things, or they might not like sweet things. And sight. They don't like looking at certain things. Light. Some lights can be too much for them. Some they don't want the light. Sound. They might be sensitive to certain sounds and even block their ears, or they might make a lot of sound. So they can either have heightened or lowered senses. And the last thing that I wanted to talk about is, which is what we commonly see, is abnormal sleeping patterns. Most of them have difficulty sleeping, and this is what people present with. And just to end, I hope this is informative. I don't want people to look at their children and diagnose them with autism. These are just the red flags. The best thing that a person can do is to go to the nearest clinic, mental health care center, psychologist, or psychiatrist who can make an assessment and evaluate if the child is having autism spectrum disorder.